A shift in numbers and mandates. Some county offices, even some schools, unmasking. And speaking of schools, getting a handle on violence. We'll take a look at ideas to lower the temperature. Hello everyone, I'm Jason Newton and welcome to 11 TV Hill. We are seeing some promising COVID numbers as of late. While there's been a slight rise in cases, the positivity rate saw declines last week. That said, the work of frontline workers is not done. COVID has only added new challenges to healthcare workers. And in this morning's cover story, 11 TV Hill contributor Tommy Clark sits down with two healthcare professionals about what lies ahead.
Doctors say the ongoing challenges of COVID-19 may be here to stay for a while, but what's changing is how they deal with those difficulties. Inside Mercy Medical Center, that means anticipating when the job is about to get even more demanding.
In the last, few surges that we've had, we've kept the clinic going normally.
Dr. Sandy Kataya treats patients with cancer or blood disorders. She says COVID-19 continues to cause delays for patients who get infected and have to postpone treatment. Yet they've managed to adapt to that and stay on track.
Initially, we saw a lot of patients with neglected cancers, and that was pretty awful. They were afraid to come in because they were afraid of catching COVID, and their cancers grew in the meantime, and that caused things to be more difficult managing and catching up to their disease. But I think it's gotten better, honestly.
South of the city in Anne Arundel County,
I think we have the tools we need to be able to get through this and to live with COVID, right? COVID is going to be here. It's not going to go away.
Dr. Nilesh Kalyanaraman says those tools have been born of obligation. Frontline workers showing up no matter the next trial.
When something comes up at night or on the weekends, we're there to do it. But that just, that leads to burnout.
We want to be able to take care, have still our family lives, our work lives, and be able to find the balance between giving good care and not burning out to the point where we just want to walk away from it all.
Which can be difficult when the already heavy load health professionals carry spirals into something more personal.
There's certainly been intimidation and harassment, and that's been really challenging because everything that we're doing is in service for the community. And so it can be really hard on our staff when they're subject to that kind of behavior.
Despite all of this, they're still stepping up and getting recognized. Dr. Kataya is a Castle Connolly Medical top doctor. She's one of 13 Mercy physicians on the list. And Dr. Kalyanaraman is among the state's 24 health officers named Marylanders of the Year. Both hope that as COVID continues, so will support for their teams and every other healthcare worker.
It's recognizing that we're human too, that it's hard on us. And then saying, well, what is it that you need? How can we support you? I think a little grace goes a long way.
And contributor Tommy Clark is joining us now. And Tommy, I want to go back to something that Dr. Kalyanaraman was talking about. Is that intimidation? Because it was really real. And I'm curious of how they move forward, knowing that's in the back of their mind.
That's right. How unfortunate is it that they have to deal with that, and increasingly so since the pandemic hit a couple years ago now. He says that they have to recognize that, talk it out as a team. He says thankfully it is the outliers that behave that way. The bulk of the community supports them, cares for them, but of course when that does happen, they have to take action, work together as a team to prevent it. Jason?
Right, and we've been going through this pandemic for so long now, and you sort of forget about the healthcare workers, and they've been doing this for maybe upwards of 2 years. There has to be burnout there, and that burnout then leads into shortages. And just give us an idea of how a health department deals with folks who decide, this is it.
That's the problem, is that everyone is experiencing those staffing shortages. They are widespread and throughout every medical practice that you'll find across the state of Maryland. So doctors we spoke with say the best way to handle that is they're putting an emphasis on scheduling, trying to make sure that their employees are not taking that burnout, that what happens during their workday home with them, and working together as a team, really talking it out, saying, okay, if we're having a problem here, let's address it. Let's make sure you get those vacation days and really better serve their teams. But of course, this is a problem that is going to continue to happen because when those surges take place, they have to show up on the front lines. There's nothing they can do. So of course, we can better serve them by wearing those masks, getting vaccinated, and hopefully preventing more surges. Jason?
All good advice. This is 11 TV Hill contributor Tommy Clark. Thank you again. We appreciate it.